Well, today on Lunchtime Live with the Center, Glorimar Diaz, who is one of our APRNs, is here to talk about what an APRN does, what's the role of the APRN at the center, how she works with patients, and how she can help you during your fertility journey. Hi, Glory. Welcome.
Hi, thanks for having me.
So let's start with what's an APRN?
So an APRN is an advanced practice registered nurse, also known as a nurse practitioner. We've gone to school for extra training, and we can basically write prescriptions and diagnose our own patients.
Oh, excellent. So you've gone to school for as an RN, and then you take additional training. Is it like a couple of years?
So it's basically 2.5 to 3 years, and at the end of it, you get a master's degree.
Okay.
But not only that, you also have to sit for boards. So you have to be board certified or certified. There's 2 different ways you can do it.
And is the training for a general nurse practitioner? What does it take to become a fertility, reproductive endocrinology nurse practitioner?
That's a good question because there's different nurse practitioners. So I am a family nurse practitioner, and Deb, who is my counterpart, she is an adult nurse practitioner. So
Okay.
you can actually subspecialize. And as you can see, Deb and I actually have 2 different subspecialties, and we're both fertility nurse practitioners. So you can choose what you want to study. There's actually a women's health nurse practitioner. And you basically just have to find some incredible doctors who are willing to train you.
Okay, so you got the fertility portion of the training in the job. Is that how it works?
Correct.
And okay.
So I have experience in OBGYN. My nursing career is basically, mostly all OBGYN. And most of my prior experience was here at the center. So when I went back to school, I kind of knew that I wanted to be a fertility nurse practitioner. And the docs were nice enough to bring me on board when I graduated, and they took their time. It took me about 1.5 to 2 years to fully get trained as a fertility nurse practitioner and be fully independent.
What inspired you to take that next step in the additional training?
I think after about 5 years of being a registered nurse, I thought that I wanted to do more. I wanted to be more involved with my patients. I wanted to do more procedures. I felt like I wanted more autonomy in my role. And being a nurse practitioner, I felt was going to allow me to follow that. So I decided to follow that path.
Excellent. So you talked about procedures. What procedures does an APRN? Do you perform at CARS? How do you assist the doctors in the care of our patients?
So at CARS, I perform morning ultrasounds. So you will see me in the morning when you come in for your ultrasounds during an IVF stimulation cycle, or if you're doing an IUI. I also perform sonohistograms, which is your water ultrasound. I perform new patient ultrasounds. So if you're getting your ovaries or your uterus checked, I also do those. I do pregnancy scans. So if you're coming in to check that little bean, I am here to check that out for you. I also do pap smears in case you need a pap smear. I do endometrial biopsies.
Okay.
And I see my own patients as well.
So, and do you see, you see your new patients, can you talk about the patients you do see in your clinic?
So mostly I see patients who are utilizing donor sperm. So my subset of patients are patients who are going to utilize donor sperm in order to obtain a pregnancy. So that can be a single female who wishes to pursue a pregnancy utilizing donor sperm, or a same-sex couple who wishes to pursue a family using donor sperm, or basically anyone who needs to use donor sperm for any reason. So I get them ready. I do all of their prerequisites. We meet, we have a consult, we talk about what's involved in using donor sperm. And then I do all of their workup. We get
Mhm.
them all set for cycling. We start cycling, and we do about, depending on how everything goes, we can talk about doing about 3 cycles together. And then if for whatever reason their journey doesn't end up with a pregnancy with me, then we talk about potentially scheduling a consult with one of the physicians to talk
Okay.
about being a little bit more aggressive.
So does now Deb is the other APRN, Deb Hins.
Mhm.
Does she also do this? What does she have a specialty within the practice?
Yes. So Deb and I see the same subset of patients. She also sees TDI patients.
Okay.
We will also see patients who need a workup for IVF on
Okay.
occasion,
Okay.
who just really need to get into the clinic and there's just
Mm,
no appointments available. But that is just on occasion. Um,
okay.
So Deb does see a different subset sometimes in Brantford. She does assist the physicians there, but we basically stick to our TDI patients
Okay.
and assisting the docs wherever they need help.
So when you talked about you do some procedures, when does the doctor become a part of the patient's care? Is it only if the procedure doesn't work in the TDI or the donor
No. So
examination?
basically, the doctor is involved almost every step of the way. We like to keep them informed of what we're doing. So once I see a patient, the doctor, every patient is assigned a physician at the beginning of their care. So, yes, I am the patient's primary provider. However, the patient has a attending of record,
Mhm.
which is a doctor that they're assigned to when they come in through the doors.
Okay.
And then as they proceed through treatment, if there's anything that seems to be amiss or is abnormal, Deb and I will usually consult with their physician of record and let them know, hey, this seems abnormal, or what do you think about this? Or I have this patient. Do you think that this might be a better choice? So we're always consulting with the physicians.
Okay. Okay. Now you've been doing this for over 5 years, like you mentioned, I believe, right?
Almost 9.
9 years.
Yeah.
What's your favorite thing about your patients and about being a fertility nurse practitioner?
I think obviously the prize at the end.
Yeah, right.
Everyone, I mean, to see that heartbeat on the screen at the
Yeah.
end, I think is everyone's favorite moment, but especially mine, because it just means that all our hard work paid off.
Yeah, that's excellent. All right. Glory, thank you for being here and thank you for sharing this information, especially for, it'd be great and helpful for for patients who are coming to see you to get to know you a little bit too.
Oh, thank you.
All righty. So if you'd like additional information, just check out our website at yukonfertility.com and we will see you next time for another Lunchtime Live. Bye for now.